Okay, cool. Hi, my name is Michelle, and I graduated from Chico State in December 2024, and I'm currently a float nurse at UC Davis Medical Center. I'm cohort 53, and we started in May. So I just wanted to talk a little bit about applying to jobs first. I know it seems really daunting, especially if you haven't looked at any applications so far, but basically all of the applications consist of the same things. They're all online and it just talks about your work information, work history, any certificates like the NCLEX or ACLS, BLS, like certificates like those. Most jobs want you to have a resume. So on the resume, you can put your volunteering experience, preceptorships, clinical hours, um, and then the cover letter. So the cover letter, I would say, is really important because this is the moment where you can actually write about yourself and show the hospital who you are as a person. Because the resume and online app is very similar for every applicant. So use the cover letter to your benefit and share your personality through it. You
Okay.
also have your letter of recommendations. These are usually 2 to 3 letters from professors, clinical instructors, or preceptors, and each application will have its own what they will tell you what they're looking for. And there'll be transcripts to show that you did graduate from nursing school, and then a supplemental where you can also take this chance to talk about yourself more, talk about how you are culturally competent or how you can work in teams and adapt to different environments.
Oh,
The
wait,
of
Michelle,
the
I think
oh,
I think it's stuck in one slide. Like it's not, are you going through your slides right now?
it should just be it's like just applying to job slide.
Oh, okay. It's
That
only
one.
showing like the first slide.
Oh, how do I fix that?
Um, is there a way to like share the actual tab where you're showing the presentation?
Is that better?
Oh, wait. Oh, there. Yes, that's better. Nice.
Yes?
Yeah, you're good.
Okay, cool. Sorry about that. Um, some application tips I have are that you should try to apply as early as you can. A lot of the websites will close after a certain amount of applications, so it's not always time-based. And I've noticed from last applications that I've done as well that when everyone tries to apply at the same time, like in the end, some of these websites will crash. So just try to stay on top of it and apply as early as possible. I like to keep a spreadsheet of applications that I've done or applications that I want to do because the timelines are very short. Some of them are only a few days, some of them are like a week. But I like to keep all the dates organized and have all of the websites in a spreadsheet so that I can keep track of what I've done, what I need to do, and what opens in the future. So I linked one of the spreadsheets that I created over here, so I can share the PowerPoint with Josh and May later, and she can send it to you guys. Um, I'd also recommend to line up your letter of recs as early as possible. Preceptors and instructors are more likely to write you a letter of rec if you ask early and give them a lot of time. Um, and also, sometimes applications can open up really randomly. So I think it's always good to have them put aside just in case one requires it and you don't have time to grab one. Always keep looking for some of the applications. Some of them don't really post when they're going to open and they just open, especially if you're not already interested in the hospital. So check Indeed, LinkedIn, Facebook, new grad groups. There's a lot for whichever area you want to work in. I was always looking every day, and that's how I found a lot of the hospitals that I applied to. And you can apply everywhere. It's good to be selective, but I also think it's good to keep an open mind to apply everywhere and get interview experience. I would say you don't want your first interview to be at the place you really want because you want to know how the format of the interview is and how prepared you feel like. And I recommend to tailor each app. So look at the job description. Each job description will tell you what they're looking for, what the hospital values. Pull from there and add that to either your supplemental questions or your cover letter to show that you read up on the hospital and that you're interested and that you fit the values. And then also save all your copies of applications just so you have a reference so you know what you applied to. And then check your email daily. Just stay on top of all the responses because if they ask you for an interview, you want to make sure that you respond and get that so you don't miss your chance. So specifically for UC Davis, we hire into MedSurg Float Pool, ER, L&D, Oncology, OR, PICU, NICU, and ICU float. Cover letters, resumes, and unofficial transcripts are required, but we recommend the letter of recs and certificates. And UC Davis does it a little different. They like to have all the documents in one file, or else they won't look at your application. And for Davis, you don't actually apply to a specific unit. They will actually match you to a unit that's hiring based on your clinical experience. So I did my preceptorship in like a telemetry floor, but they weren't hiring in a telemetry floor at that time. So I got hired as float pool. And then the next application period for UC Davis will be from November 5th to 12th, and they hire for two cohorts at a time, cohort 56 and 57. So for interviews, um, I think most interviews now are online. I think there have like some, I've only been to one in-person interview, but many of them use a panel. So when you get offered an interview, make sure to ask if it's a panel or one-on-one. That way you can be more prepared and you don't get like jumped by like four people at one time and when you were expecting one person. They're usually 30 to 60 minutes. And if possible, ask what unit you're applying for because it'll help you prepare because they'll ask scenario-based questions tied to that unit. Most of the interviews that I've been to ask behavioral questions like, tell me about a time you care for a culturally competent patient, or why you want to be, why are you interested in this hospital or unit? Some tips that I have are to practice out loud. You guys have probably heard this a lot, but practicing really does make it better. Knowing what you want to say or reciting, it'll just be like muscle memory at that point. Um, know the hospital, like I said, in the applications, know the missions, values, and specialties, and try to weave those values into your answers. It shows that you are really interested in the hospital and that you did your research. You can also look online for previous interview questions. I looked on like All Nurses and Reddit. Sometimes they'll post some of the questions that they were asked. And then this would be the most important, I would say, have like 5 to 6 examples ready. So have an example for when you showed good teamwork, when you showed good conflict resolution with either patients or with coworkers, patient care challenges like what if your patient refuses all their care, or how are you going to time manage this, this, and this? I also linked a document of some questions that I found helpful when I was preparing for my interviews in this slide as well. Before you start your interview, I would have a few questions that you want to ask at the end. What I asked was, what do you do to support new grads, or what are the qualities that you find make new grads more successful in this role? This shows that you are learning, you want to grow and learn. And when you're interviewing for a place, you're also choosing that place. So make sure that you like get all the information that you want to because you're choosing them just as much as they are choosing you. And then just the basics, have everything set up, your audio, your Zoom, make sure it's like updated and dress professionally. And then try to be yourself. I know it's really hard to be yourself when you're nervous and scared, but interviewers want to get to know you when they're talking to you. So it's not only about like what you would do in certain situations, but it's also how you would get along with the team dynamic. Each unit has a different culture, and when they're interviewing you for their unit, they want to make sure that you will fit in with the other nurses on that unit as well. And then lastly, I'm not sure if you guys have heard about the STAR method for answering interview questions, but it's using the situation, task, action, and result method to structure your answers. I talk a little bit more about that right here. So like if the question was, tell me about a time you had a difficult patient, you would start with a situation. It's kind of like the S bar. Um, you talk about what was happening, you're setting the scene, who's involved. So for this question, it could be during a clinical rotation, I had a patient who refused vital signs and medications and became frustrated whenever approached. The next step is to show them what you did, what the problem was, what the goal was, and what your expectation is. So I needed to provide care while respecting their autonomy and building trust. Using keywords like autonomy and trust also gives you bonus points. Um, Next, you're going to tell them what you did. So, specific actions. I listened to their concerns, validated their feelings, and educated on the purpose of each task. Offer choices like timing so they felt more in control. And then lastly, its result. So, what happened? Like what, how did you resolve the situation? The patient eventually agreed to vitals and medications, and our interactions became more cooperative for the rest of our shift. So this STAR method is just a quick and concise way of like summarizing the whole situation, like what the problem is, what you did, and how you learned from it. Whenever you give like a not like a wrong, but like a conflict, you always want to show resolution. Don't just leave it out of conflict. And lastly, I'm going to share a little bit about my experience at UC Davis. So the application period, I applied in November and they got back to me in, I think, like late March. And I interviewed like end of March and then they told me the decision in April. So UC Davis is a little bit slow at getting back to you just because they interview or their application is for two cohorts at a time. They usually do interviews 2 weeks after the previous cohort starts. So I guess you can kind of use the website and see what cohort dates when they start to kind of have a feel of when the timeline will be. At Davis, they do 2 weeks of orientation. So it'll be like 2 weeks of like classes from 8 to 5. And then for float pool specifically, I'm not sure about other units, but for float pool, we change our unit each month. So we get to experience like all the med surge floors before we start daily floating. So for the first 2 months, we'll have a preceptor. We'll follow them for every shift. And then after 2 months, each month we go to a different unit. We'll get 3 days of preceptoring, and then we'll work independently for the rest of the month. And then at 6 days, we switch off to 2 days of orientation and then we'll work independently for the rest of that month. So we switch every month. So it is a little bit hard, but it is good to get experience in each unit before you start working and daily floating. After a year, we'll get our 3 shifts of precepting with a daily float nurse, and then we'll be able to float by ourselves. So this timeline does seem a little scary, but it's not as bad once you get to the point. Like at 2 months, I was like, oh, I can't do this. At 3 months, I'm like, it's a little better, but it's still hard. But your first year of nursing will be a lot of learning, a lot of asking questions, and it's okay to be unsure. Just make sure you ask. They will always say like, no question is too dumb, or like it's never enough questions, and it's really true. Um, so yeah. I think that's all I have. Do you guys have any questions?
Thank you, Michelle. I can start with a question.
Sure.
Um, what is something from nursing school that isn't really like, your process of applying that you feel like helped you when
Mhm.
trying to get into a residency program?
I definitely think like being as involved as possible, like you mentioned, like the United in Nursing elections. If you can, if you have time, I would recommend to go for it. I think I was treasurer for Chico State Nursing Club for like 2 years. So if you can be involved, if you have the time, I would recommend you do so. And if you can't, like that's okay. Like try to volunteer for some events. Volunteer for like the flu clinic if you could, if you can. If you're able to like find a part-time job, it doesn't even have to be nursing related. If you can show that you like are good at teamwork, good at communication, that really helps. I know a lot of the behavioral questions that I were asked during my interviews, you can like pull from experiences that aren't nursing related. So I worked as like a child care like camp I can't speak, counselor, and a lot of questions were able to be answered with that because it shows like conflict resolution or teamwork. So just any way you can get more like people social interaction is really good. So you can pull for those experiences.
Thank you. Does anyone else have any other questions?
I have a question.
Okay, sure.
Hi, so for UC Davis specifically, I heard other people they start to apply around when they finish third semester or when they starting fourth. Do you recommend us to apply like super early, like 1 year before you graduate or like half a year before you graduate so you can like secure and be able to like avoid that crash out?
That's a good question. I'm not sure how the timeline is specifically. Like I applied in my fifth semester. I think if you applied in third semester, it would be too early because by the time you well, I guess it depends on the timeline, but if I applied in my third semester, I wouldn't have made the cutoff because it starts in May, and I graduated in December. So it does depend on like the timeline. Like I'm sure you could probably apply in fourth semester for a specific cohort. You have to look at the specific cutoff dates. It'll also tell you the date that they want the NCLEX to be done by.
Oh, okay, got it. Thank you.
You're welcome.
I have another question.
Sure.
Sorry.
No worries.
Okay, what am I gonna ask him? Sorry. Oh my God, that question. Okay, let me think. Sorry. If
That's
anyone other question, please jump in. I'm thinking that question right now.
I have a
Oh,
question in the meantime. Oh, no,
uh,
you go first.
sorry. Okay, my question is, how do you guys find these residency program and how do you find a reliable one? How do you find like overall, how do you guys be able to like spot these residency program? And and also how do you make sure that they're legit, they're real, and they're like, for sure helping nursing students be able to like transition from nursing school to hospital.
That's a great question. So I think a lot of the very popular nurse residency programs, a lot of them are I think it's like AACN or Vincent accredited nursing programs. And if they have that logo, it shows that they are recognized for their nurse residency program and how they help transition nursing students into like new grad nurses. So it's like I think you can search it up. I don't know exactly how it looks like, but it looks like a shield and then it's gray and purple, and it'll say like AACN accredited nursing program or nurse residency program. And that's how you know that like it's legit. But there is other nursing programs that aren't accredited that are still really good. You just have to look for them. It is a little bit hard. Like some of them do look a little bit like sus, I would say, especially if you look on LinkedIn, some of them are some weird links. So you really have to like, you can look at it on LinkedIn and then I would go on a separate website and search up the name and like see if you can find any like information on that. But I wouldn't go through LinkedIn because while it's a good place to find like applications and job openings, some of the links are like very old. They're from like 2023 and they're expired. So just make sure you find the most recent one and you're applying to the one that's open right now. But
Oh,
yeah, sorry, go ahead.
oh, you're fine. Sorry, I was about to say thank you.
Oh, yeah, of course. I would also recommend like sharing with like your cohort. We did a lot of like sharing spreadsheets of like what are opening and stuff like that. But you can also find like some spreadsheets that have um, residency programs that other people apply to on like new grad groups and Facebook. I can also share some of the ones that I applied to, but the timing will be off because it'll be when I applied. But I can share that with Josh and May too in case you guys are looking for more. But I just applied to everyone in California. Um, and I think it's like, I don't mind. It's up to you of where you like what you would move to, like where you would move to. But I think for your first job, just to be more open-minded, just because it's a little bit hard to get jobs in nursing right now.
Got it. Thank you so much. That is so helpful.
You're welcome, Leo.
Thank you.
Mhm.
I was just gonna ask, since UC Davis takes so long to get back,
Mhm.
like was there a situation where you got like accepted into another new grad program and you were like holding out for UC Davis? Like how would you handle that situation?
Thanks for your question, Luke. Yes, this actually happened to me. I got accepted to a residency program in, I think it was in like Seattle. Um, but I really wanted the UC Davis one. So I interviewed for the UC Davis one and they were gonna tell me their decision by April 1st. But I already got an offer from the one in Seattle, and that one, that offer ended on November, or what was it, March 28th or something like that. So it is really hard because you're basically like betting, like, oh, will I get, if I get into this program, I'd rather go to UC Davis. But if I don't get in, then, and I reject like Seattle, then you're kind of like stuck nowhere. So I can't say what the right thing is to do, but I just I held out for UC Davis to be honest, because that's where I really wanted to be, and I didn't want to move to like another state. But there's no right answer. You can always ask them, ask like the other residency program to extend your offer, but if they aren't able to, it's a little bit hard. Um, Yeah, I'm sorry. There's no like really good answer I can give you for that question.
No, that makes sense. Yeah.
Yeah,
Thank you.
you're welcome. You have any
I
other?
had a, oh, sorry.
Go ahead.
I had a few questions. I was wondering how did you time your NCLEX and like taking it?
Okay, clicks. So I graduated in December and I went on vacation for 2 weeks. And then I took my NCLEX on February 14th. So I think I gave myself like 3 weeks to 4 weeks to study for it.
Yeah.
Um, It depends on how like each person likes to study. I know people like some people are better at studying like short term because they feel more pressured and they like focus more.
Mhm.
If that's you, then that's great. Like 2 to 3 weeks. I would say at least 3 weeks. But some people like to study for 2 months, and it's just how you prefer to do things. I wanted to take mine as soon as possible after graduating,
Yeah.
just because I wanted to retain all the information. And in the last semester, in your fifth semester, you do a lot of like ATI testing, which I think was really helpful. Um, I used Archer and I just basically did like the whole quiz bank. They have so many questions for you to use, and honestly, that helped me the most. I would say that the lectures were quite long for Archer, so I would only really like focus on the topics that you're struggling with because I think the quiz bank was the most helpful to me. But it depends on how you learn. So I learn more like hands-on. I'm not as good at like listening to videos and stuff like that. But just
Awesome.
give yourself a few weeks. You know how you study best.
Yeah.
Yeah,
Absolutely. Thank you.
you're welcome.
Um, and then I was also wondering, I know you mentioned you applied to like every single one in California. Do you
Mhm.
have like a would did you like do you have like a minimum, I guess, recommendation that you would
Mm, that's a good question.
if for a person who wanted to, as much as possible, try and get a residency program in California?
Mhm. If you don't care, like we're in California, I would literally just apply to every single one that is open in California.
Okay.
Just because it's good experience. Even if you don't want to go interviewing there is great. Just so you know how it's like to be interviewed
Yeah.
for the nurse residency program. I think I applied to like 80. So it's a lot, but
Oh,
it's not too bad after, like, if you have all your files together, if you basically have a template for your cover letters, like for pediatrics, I would have a cover letter that's a template for that. And then for like adults, it would be different.
yeah.
But have a template for everything, and then you can kind of adjust for that.
Okay.
But it is a lot, but some of them are easy. Some of them are just resume, transcript, cover letter, letter of recs, and that's it. No supplemental questions. Some of them do take a little longer, and I would spend more time on the ones that you really want to go to, but I would recommend at least like 15 to 20 would be safe. But yeah, the big ones are really hard to get into just because everyone's applying to those. But you can try like a few times, like the Stanford one, you can apply for a few times because I think the cohort dates aren't too far apart.
Nice. Awesome. Thank you.
You're welcome.
Sorry, I just had one last question.
No worries.
And it was just a clarifying one because you mentioned this earlier. It was about the timeline of when UC Davis's uh, next application starts. It was something like UC Davis's interviews or applications start about 2 weeks after the previous cohort starts.
Oh, the interviews start.
Interviews. Okay.
So it's kind of like here, I don't know if I can show you here, but are you guys able to see my screen?
Yes.
Okay. So like right here it says cohort 56 and 57. So the application period is November 5th to 12th for both of those cohorts, but they start at different times. So I guess my interview like timeline was more for like if you're applying to cohort 57, well, you don't have a choice, but like if you applied in this time period and you haven't gotten any information by like I would say February, that probably means you didn't get into the March cohort. But
Okay.
that doesn't mean you didn't get into the May cohort because they consider for two separate cohorts at different times, which is a little confusing. But if you're applying to the cohort 57 one, the cohort before starts on the March 2nd. So I would give it 2 weeks because they do orientation for 2 weeks. So
Okay.
maybe like March 20th, they would start sending out interview like offers. That's like, yeah, that's was what my experience is and like my experience talking to the like my units managers.
Thank you.
You're welcome. Any other questions?
I have a question again. So I heard that you applied to like 80s on
Mhm.
80 plus. That's
Yeah.
great. That's so great. And then for me, I always wanted to do L&D or like Peds or anything NICU. And
Hmm.
for me, I know that you're in UC Davis now and they do like they do based on whatever they need people.
Hmm.
Out of the 81 that you apply or more than the 81 that you found, is do you think there's actually possible that there's ones that actually only hire for this position? Like let's just say you want to go into like OR. There's gonna be one that's like specifically for OR, or is
Yeah,
it most of them
definitely.
are or is it most of them are like just, they'd be like, oh, we just gonna hire you based on whatever it's available.
From what I saw, most of the applications actually do let you choose what unit you want to apply to. Um, and a lot of them are like med surg, tele, or like cardiac floors. But they will tell you on the job description what you're applying to. Some of them only allow you to apply to like one place, but I think some other places like their San Diego's residency program lets you apply to like every unit that you want to apply to. So definitely depends on the hospital. UC Davis just doesn't let you choose, but a lot of the other ones do let you choose like or at least let you give your preference like for your top two units that you would want to be hired into. And then a lot of them will also be have like a choice that says like I only want to do like NICU and don't consider me for other choices. I would recommend even if you want to do like NICU or like L&D only, if you're like super set on that, then that's great. But I would like put L&D or NICU on your like top priority, and then the second one just be like whatever one like your next choice is. Just because all the specialties are really hard to get into, just because they have a lot of like very little spaces, and everyone wants to kind of start in a specialty in the beginning. But you
Oh,
can always move. It's okay. Like get a year of experience, and they can always change.
okay. So do they usually like so for the residency program, like how does it work? Do they just like take you in for like a year for you to like um from what I heard is that like people said that like they take you in, you get to like learn from it and then do things, and after a year they can like they're gonna hire you again to be one of the staff, or am I wrong?
No, you're not wrong. It's different for each hospital. Some places, the nurse residency program is like a trial or like a probation run. Um, and some places, once you're hired, you will have a probational period, but you are like already a staff nurse. So for Davis, you're hired for it's not a contract, but for the first 6 months you're on probation, and then after that you would be promoted to clinical nurse too. For other places, it's different, but I would say like most of the time they will tell you in the job description what you're getting yourself into for the nurse residency program. They usually do say like 1 year commitment, but I haven't seen one that actually like forces you to sign. Oh, actually that's a lie. Some of them will ask you to like sign a contract that says like, "Oh, I'll work here for a year or 2 years." Like because they're training you for it. So it will tell you on the job description. Um, yeah. Did I
Got
answer
it.
your full question? I feel like I skipped part of it.
You're fine, thank you. I have two more questions. I'm so sorry. I just really wanted to get to know this. So like
Mhm.
for like residency program, let's just say you got into that unit or got into that place and you really don't like it and you cannot really hold it for a year. Is it bad to just quit in the middle?
Um, I would say yes. But if you feel like you can't do it, then I wouldn't force, like, don't force yourself. You can keep applying still. Like, you don't have to, if you hate like a place, you've been there for 2 months and you hate it, you can still keep applying to other jobs. But some places, like a lot of the nurse residency programs, they don't want to hire people who already have previous experience as RNs. It depends on how long the experience is, but each one, like Davis, doesn't want any experience. So if you can stick out for like a year, that would be great. But if you're unable to, you can always talk to your like manager. Oftentimes they will help you like try to move units or like see if they can help you work something out for you because they don't want to like hire you for a little bit and like fire you or let you go either. That's like not in their best interest as well. So definitely talk to your management. They'll probably do as much as they can to help you. For ours, I know we have like this bridge program where if we want to explore other units, we're able to shadow another nurse in that unit and see if we would like that better. So
Mm-hmm.
definitely just talk, like communicate. Don't just like be like, hey, like I'm done, but definitely like communicate with your managers because they can help you and pull some strings for you because you're already in like once you're into the hospital, it's a lot easier for you to move around.
Oh, okay. So like basically you do that residency program probably like a year, and after that it's pretty flexible for you to like switch it if you really don't like.
Yeah, the residency program is not really a commitment unless you signed like a like 2 year contract. It's more like saying that, oh, this is they're gonna give you like preceptors and orientation, and then you also get like classes on top of that just to aid in your transition. But it's not like, oh, you have to stick to this for like the whole year unless your contract says so otherwise.
Okay, gotcha. Thank you so
You're
much.
welcome. Okay.
I know you have to go now,
Yes.
so we'll let you go.
Thank
Thank you so
you.
much for your time, Michelle.
You're
Um,
welcome.
Everybody here definitely appreciated everything that you
Of
had
course.
to share with us. Um, but yeah, I'll be sure to send everybody your slideshow. And also, I don't know if you guys all caught it, but at the end of the slideshow, it also has Michelle's email. So you can also reach out if you have any questions afterwards. But yeah, thank you again.
Thank you. Feel free to reach out if you guys have questions. Bye.
Thank you,
Bye.
Michelle.
You're
Thank you.
welcome. Bye.
All right. With that, I think Tara is here. Hi, Tara. Is it Tara or Tara? I'm sorry.
Hi guys, it's Tara.
Sorry.
Either way is fine though. I respond to both.
You're good. So we're gonna have Tara present. She's also part of the UC Davis program. I don't know which cohort did you graduate from.
I graduated with Michelle actually in December of last year. So we got hired into the same cohort at Davis and we're both in the float pool staff.
All right. Well,
Yeah.
there's your short introduction, and you can take it away.
All right, well, hi everyone. I'm Tara. Sorry, I didn't have time to make a presentation or anything, but it looks like Michelle did and it was beautiful. So I think she got that covered. Yeah, like I said, I graduated from Chico's nursing program in December of last year. And then I took my NCLEX in the beginning of February. So I gave myself like about a month to study. Um, I did Archer for like the resources that I use, and then I also use the Mark K lectures on Spotify as kind of like supplemental. And those were really helpful as well. If anyone has any questions about that, feel free to ask. Let's see. I took the NCLEX beginning of February. I passed it first try with 85 questions, thankfully. Um, and then meanwhile, I was still applying to jobs. I applied, what was it? I think like about 50 to 60 different positions. Some of them were residency programs, and others were regular staff RN jobs for hospitals that didn't have a residency program. The only place that I heard back from was UC Davis, actually, and I wasn't even expecting to hear back from them because I thought that like the cohorts had already started. But Davis does do two cohorts per like application cycle. So if you don't get interviewed for the first one, definitely still keep an eye out for the second one because they called me for the second cohort. Let's see. For my interview for Davis, it lasted about 45 minutes. They asked me about 10 to 12 questions. A lot of them were behavioral questions, asking me well, some of them were clinical questions. I had like three clinical questions asking me what I would do in a certain patient scenario. Like if I suspected a patient was having a stroke or pulmonary embolism, stuff like that. Um, the big thing for those questions is make sure that you emphasize that you're going to reach out to your resources, like your charge nurse, you're going to call the doctor and all that stuff. Um, the other questions they asked me, it was more so like, what kind of, what roles were you involved in nursing school, like leadership roles? Like give me some examples of when you had to work with a difficult coworker or a preceptor, um, how you manage that situation. They talked about some like evidence-based research projects that we did. Definitely, if you guys did any of those, talk about those if they ask. Um, yeah, they also asked me about like my personal experiences, like with work or volunteer work. So if you guys did any of that, make sure to bring it up. Um, a lot of hospitals like to see that you do stuff like outside of nursing school too. One of the questions they asked me is like, what do you like to do, like to relieve stress? So anything that comes to mind, like whether it's working out, hanging out with friends, make sure you show them that you have a life outside of nursing, because they don't want to just like hire someone who's all about one thing but doesn't really have personality, you know? The big thing that I noticed since working at UC Davis is they have an amazing culture, like within the staff. A lot of it's a teaching hospital, so there are new residents every July. So all of those residents are the ones that I've met so far, they're all very friendly. The doctors have been very approachable. All the nurses I've worked with, they've been super approachable, very supportive. Um, and just I feel like it's an environment that thrives with like newcomers and new grads. So definitely if Davis is somewhere like you're interested in applying or working, make sure like you emphasize that you've heard about how great the culture is there, how approachable everyone is, like the support systems that they have in place. So yeah. Um, let's see. What else? Oh, well, from the time that I got the interview to me actually getting the job, it was like a 2.5, 3 week period. So it wasn't super quick where they were like, oh, we're gonna hire you on the spot, because that's kind of a red flag. But you kind of had to like sit with it. You had to sit with the anxiety a little bit. But overall, it went well. Definitely, I think I came into the Zoom late, but I saw Michelle's last slide about like the application information. make sure like when you're doing the application, you follow the instructions to a T. Because I remember when I did it, it was kind of confusing. They were asking to like for us to upload information in a very particular way, but then on the actual application, it looked a little bit different than what they had told us to do. But whatever instructions they give you for the application, make sure you follow it exactly because I have heard that they throw out applications that don't follow their guidelines. So just whatever they say, just do it. Even if it sounds kind of like counterintuitive, just do it. Um, let's see what else. Does anyone have any questions so far or anything? No? Okay. So I got hired into the float pool. So for this new grad residency as a float pool, it's a little different than if you get hired onto like one specific unit. So for the float pool, we don't start daily floating to different units until after our 1 year is over. So meanwhile, in our 1 year, we are going to one different unit every single month. So within this 1 year, I'll be going to 12 units. I'm about to start my 6th month, so I'll be going into my 6th unit. Um, but for us, we had 8 weeks of preceptorship total. I know for some other specialties, like I think L&D or like ICU critical care, they get longer preceptorships. But generally for med surge, it's 6 to 8 weeks. So we got 8, and then I was with a preceptor the whole time. So I got to precept on 2 different units. Um, I was on a trauma unit first, which was kind of rough. And then after that, I was on like a neuroscience unit, like a neurology unit, and that was pretty good. Um, for our department specifically, the management is really, really great. They're very supportive and they want to make sure like you feel comfortable in the environment you're in. So they'll like constantly check in with us. They'll make sure we're doing okay. We have classes too, like twice a month where we get to see all the other new grads, kind of do like a check-in and everything. Let's see. So each month that we go to a new unit, we get 3 precepted shifts at the beginning of the unit, after our 8 weeks of full orientation was over. So after those 3 shifts of preceptorship are over, then we're on our own. So I've been on my own like fully for like I think like 3, 4 months now. But each new unit I go to, I'll still get 3 of those precepted shifts at the beginning, kind of to like get my bearings and everything. Every unit is set up a little bit differently. The people are a little bit different. The documentation requirements are different. So those shifts definitely help with that. Um, but honestly, so far everything's been going well. I got hired on nights, so I do about 3 to 4 shifts a week, depending on what my schedule looks like. It kind of varies, but we make our own schedule, and our management's really great with giving us the schedule that we want. But I know for every unit and every hospital, it's a little bit different. So it might be different for you regarding like depending on where you go. But my personal preference, I don't really like doing three back-to-back shifts. It kind of burns me out and I feel so exhausted afterwards. Even when I was in my senior preceptorship, I did it at Oroville. I did not want to do 3 back-to-back shifts. It was just way too much for me. So I do 2 shifts back to back, like at the beginning of the week, and then I do 2 towards the end of the week. Um, it fulfills the requirement of like the 36 hours a week, based on like how our week is set up. It's Sunday through Saturday, so Sunday's the beginning of the week for us. But yeah, the 3 days is just way too much for me. I get so exhausted, and then I still have pretty bad pre-shift anxiety. So I feel like with the 2 shifts, it kind of I'm able to see the light at the end of the tunnel on the first shift, knowing that okay, I only have to come back one more night, and then I'll have a few days off. So it's been helpful for me to do that. But I know like other people, I think Michelle does threes. Some of my other friends they do threes. And they're okay with it. Um, but personal preference, I don't like it, but it's all up to you really. Um, Davis, we get a good amount of breaks actually. So I know some people like are concerned about not getting their breaks or anything, but I have always gotten my breaks, thankfully. We get one 30-minute break at the beginning of our shift, like within the first 4 hours, I think. And then we get a 45-minute break, like towards the end of our shift. Um, and then that one, like I usually eat my lunch or whatever, or I like take a quick nap. But some hospitals are different. I know like for sure you'll get a 30, but then some hospitals like do two 10-minute breaks after. Davis, they do three 15-minute breaks, but majority of the units combine those into the 45 minutes because the nurses like it like that. The 10 minutes, it just goes by too fast, you know? But yeah, the culture there has been really great. I feel like I've been able to learn a lot from all the nurses and I've found that a lot of the nurses there like they stay for like decades. So it makes me feel like the environment there is one where I can thrive, I can grow in. I haven't had any issues with like mean nurses yet or like older nurses where like I don't know if you guys have heard the saying where they eat their young. I haven't had any experiences like that yet, thankfully. Um, but my recommendation for you guys, especially if you do get hired into a float pool at any hospital, you're going to be meeting so many different people. It's really important to just like kind of be personable, like have an open attitude, open mindset, um, and try not to take things too personally. There's going to be a lot of different personalities in the hospital. Some people you'll vibe with, other people it'll feel like they're kind of standoffish, but majority of the time it's not like directed towards you. And it might just be their personality or they're just having a bad day. But I just do my best to like be nice to everyone I see, smile at everyone I see. And majority of the time, like they'll smile back at me, they'll be nice to me. But sometimes like I've encountered people who are a little standoffish or they just seem like they're having a bad day. Just don't take it personal. You're probably not going to see them again anyways. So yeah. Does anyone like have any I saw something in the chat. Hold on. When I hope to ask more about the evidence resume. So for the evidence-based project, I talked about one, I think I did it, it was in Paul's class. I don't know if you guys have the evidence-based class with Paul anymore, but we did a project in there. We also did a project in Brandon's class. I don't know if you guys have him as well, but I talked about those. I also talked about the fifth semester public health um, thing that we did. I worked with like the free clinic in Chico, the Shalom Clinic. So I talked about that for like volunteer work as well. Um, the specific question they asked me in the interview, they asked me like what projects I was involved in during nursing school. So if you guys like were involved in any projects at all, whether that's like in the nursing club or in the classes or anything, make sure to like kind of document all that, round it up. You can also put it in your resume. Like I put the volunteer work I did at the clinic in my resume as part of like the volunteer section. Even though technically it was like for a class, I still included it in there. Anything that you can really beef your resume up with, that is applicable to what you're applying for, that would be good. I didn't really include like a bunch of my work experience before college. Like I worked at multiple spots like before college. I think I only included one of them because I didn't want to like take up too much space on my resume. I think my resume was like one page because I didn't want it to be too much to where they're like overwhelmed and didn't want to finish reading it. Um, Let's see. An NCLEX resource. I heard about Archer Review. Have you utilized ATI? Um, I hated ATI. It was horrible. I did not want to do it outside of nursing school. I used Archer. I know some people use UWorld too. I just picked Archer. That's what all of my friends were doing, so I was like, I'll just do it too, whatever. It was really helpful. I didn't really listen to any of the lecture videos on Archer. I just did a bunch of practice questions. I think I did like I think I maxed out on all the practice questions that they had to offer. I just did all of those with I reviewed like the rationales behind all the answers. Definitely the ones I got wrong, but even the ones I got right, because like sometimes I just guessed on a question and I got it right, and I'm like, oh, okay, cool. But I had no idea why I got it right. So my method was just doing a bunch of the practice questions and reviewing all the rationales and just like writing notes for everything, because that's how I remember things. But I don't do well with like lecture videos, so I just skipped all of those. But I know that they offer those as well. They have a bunch of resources on Archer. Um, and I also use the Mark K lectures. I don't know if you guys have heard of him. It's Mark Klemek. You can buy the lectures, but I have Spotify, so I just found them on Spotify, and then it has all 1 through 12 lectures. And then I just did like one lecture a day, or like some of them are really long, so I kind of like split it up like in sections. And then I utilized those lecture videos probably the last week of studying, like last week and a half, just to kind of like keep everything in here, because I think by that point I was all done or almost done with the practice questions. So I kind of used the lectures from Marquez like supplement. Um, and then I put it on like 2x speed and it was fine. But yeah, the lectures on like Archer or UWorld or ATI, those were like hours and hours long. I was like, I'm not sitting here watching these lectures right now. So I just did the practice questions and then Marque. And I mean, it worked for me. But honestly, if you guys buy those resources and find that like the lectures work for you, do whatever works for you. Take as much time as studying as you feel you need. I felt like about a month and a half was sufficient for me. And I didn't study more than like 4 hours a day. And I took breaks in between, like I took weekends off. Um, I was like, I'm like, even if I had to take the NCLEX a second time, I was like, I'm just gonna take it until I pass it. So I'm not gonna like spend 8, 12 hours a day studying. It just felt excessive to me. But whatever works for you, that's what you should do. Um, when did I start applying for jobs? I started applying for jobs in I think like the second half of fifth semester. Because a lot of the new grad residency programs, they open their applications um, like around that time. So definitely keep an eye out for those. Um, yeah, I think I applied for the Davis one like October, November, and then I didn't hear anything back until March. They didn't give like any type of notification or anything either, like an email or nothing. They just called me randomly and I happened to answer. So just keep your phone on. Answer the random numbers. Even if they might be spam, just answer them because you never know if there'll be a hospital calling. But yeah. Does anyone have any more questions or anything that I didn't talk about that you want to know?
We have a question.
Yeah.
So we heard UC Davis doesn't have CNAs. If that's true, how do you kind of go about that?
Oh, girl. Yeah, they don't have CNA. Um, so UC Davis, they follow primary nursing. So primary nursing is something where like the RN basically absorbs all the other supplemental roles. Um, so yes, we do not have CNAs. We also do our own lab draws a lot of the time. Um, but we do have support staff there for us. Like we have a team called Lift Team. They round every 2 hours on every single floor. And if your patient is like a total care patient where they can't turn themselves in bed or they're super incontinent, you have to clean them up. You put their room number and your name on the list for lift team. So when they come in around, they'll call you on the Vocera. They'll be like, hey, like we're here. Do you need help? And then we'll like you kind of have to like organize and time manage yourself around when they come. But a lot of the time they'll come, they'll help turn the patient. We'll clean them up. They don't do the cleaning, they just do the lifting and the turning. But we'll clean them up and then we they like help you boost them back in bed too. Or if you have like a really extensive dressing change or really extensive burn care, like on like the whole leg or something, and you need them to like lift the leg, they'll do that for you too. Um, and then you can also call them if you miss them on their rounds. You can put in a request for them to come in like when they're not rounding, and then someone from the team will come. So they are really, really helpful. They're amazing. Um, but it's a little difficult because you have to like manage your time around when they come and round, you know? Because like if you're busy with another patient and they call you and you're like, I can't get to it right now, then you're kind of screwed at that point. But um, even then, I've had that happen to me, and I just ask another nurse if they can help me real quick, and everyone is super approachable. So yeah, we also have we have phlebotomists. So, but like a lot of the time, we end up doing our own lab draws because the phlebotomists are kind of limited on what they can do. Like for example, if the patient has an IV like on their hand, the phlebotomists are not allowed to draw anywhere below an IV. So if they have like one IV on both hands, the phlebotomist cannot draw blood on them. But if they have an IV like in their AC or their forearm, then the phlebotomist can draw on their hand. So it's like you kind of have to like be aware of that. Um, but some specialties as well, they only want RN lab draws. Like I know for the neurology patients, the neurology team only wants RNs to draw the blood for their patients. I don't know why. I'm like, okay, whatever. The phlebotomists are better at it than me. Like I don't know why you want me to do it, but okay. But yeah, so you'll get really good at kind of like lab sticks and all that. I still suck at IVs, but I could draw blood. But um yeah, and then you can put your patient on like the list for phlebotomy if they meet the requirements, like it's fine. But if the doctor puts in an order for like stat labs, then like you have to do it yourself. The phlebotomist can't do it. Yeah.
Got
So
it.
there
Thank
are
you.
resources. Yeah, no problem. There are resources. You do end up doing like a lot of stuff yourself, but the people I've met, they've all been super helpful. Like everyone is willing to pitch in wherever they're needed. So it hasn't been too bad. Anyone else?
Sorry, so to add on to that, does that mean that you get less, like your patient ratio is lower than it usually would be?
Yeah, so the floors I've been to so far the max amount of patients I've only had four. Um, I know a lot of other hospitals in California, like the max is five for med surg floors, but here, unless they're super short staffed or like the hospital is like packed, then I think they can do five. But so far, all I've ever had and all the other nurses have had is four max. Some units you'll only get three, depending like on how hard the patients are. Some of them are a lot more complicated than others. They like require more care or they're like total cares. So then in that case, you'll get three. Um, on the progressive care unit, the PCU, the minimum you can get is two. The max you can get is three because a lot of those patients are coming like from post like cardiac caths or they're intubated or they're on like a bunch of different drips. So it's kind of like ICU. In the PCU, you could get like two patients, but they'll be heavier. Yeah. But honestly, the ratios have been great. I'm like, give me four. I'm good. Yeah. Yeah,
Perfect. Thank you.
no problem. Um, any more questions on like day-to-day stuff or just like technical things? No.
All right. Does anyone have any questions? If not, Tara did send me her email. So, again, if you've scanned that QR code, and logged your attendance, I'm going to be sending an email later on with everybody's information. So if you have a question that comes up after this meeting, feel free to send it to her through her email. But thank you so much, Tara, for taking the time to talk to us. Um, yeah, that was all super helpful. I kind of like how you and Michelle had like completely like different perspectives in your presentation, and I loved that.
Oh,
Um,
did we? Okay, good.
yeah, it like
I
it was like hers was more pre like getting in or like trying to get in, and then yours is more like post and like the experience. So it like really meshed together very well.
Good, good. I'm glad. Yeah, if anyone has any questions, I can also put my email in the chat right now if you like come up with a question once I'm gone. Um, yeah, don't like hesitate to reach out. And good luck to everyone. You're all gonna do great. I don't know what semesters everyone's in, but if you're in fifth semester, don't stress too much about everything. It'll all work out in the end. You've had 2.5 years to prepare for the NCLEX, and you will learn everything you need to learn on the job. I promise you. All right. Thank you guys.
Thank you, sorry. Ta Tara, I'm
You're
sorry.
good. You're whatever's easy for you. You're good.
All right.
All
Thank
right.
you.
Bye.
Bye. Okay, so that brings us to our last presentation. Yes, if you haven't signed in to the QR code, I'm just gonna send the link in the chat. Just give me a second. We'll go on to our last guest speaker, and we have Rebecca here with us, and she got into the Kaiser Permanente nurse residency program. So, if we could all give her our undivided attention and welcome her to our meeting.
Hi, my name's Rebecca. I also graduated with Tara and Michelle. All three of us were in the same cohort. Um, but yes, I'm Rebecca. I have been working at Kaiser since July 28th. I'm a part of NorCal, so I got into the NorCal Kaiser residency program, and I am in med-surg slash telemetry. So it's a tele floor, but can also have med-surg patients. So Kaiser NorCal only offers med-surg or med-surg tele. No other units, just those. And unfortunately, Kaiser is so hard to get into. I honestly don't even know how I'm here, but I'm so grateful to be where I'm at. Just a little bit background. I I graduated in December. I took the NCLEX in January. I took it the same week that I got the whatever it's called, the ATT, only because I'm a little crazy. Like, I didn't want to think about the NCLEX at all. Like, I just wanted to get it done and over with. And I didn't study. Don't follow me, but I'm a very like just get it over with type of person, and it is what it is type of person. And it worked out for me, but it might not work out for everyone. Um, so yeah, I had this mentality af when applying to jobs. I applied to jobs also in fifth semester, but I didn't have that great of a mentality. And I think it's important to speak about it, especially to you guys that are nursing students. I had this mentality that I had to go to my dream hospital and that I couldn't go anywhere else. And it was kind of toxic now that I think of it because I told myself that I was going to get into Stanford and that's where I was going to go. And I had very high hopes in myself. I was very confident, but I realize now that I should have spread myself out more. So yeah, when I applied during fifth semester, I only applied to Stanford in Palo Alto and Stanford Pleasanton and UC Davis. And I heard back from both of the Stanfords. I did get interviews, but I didn't make it. And I think that was like a big reality check for me because that was in January, February. And I was like, wow, like I should not have put all my eggs in one basket. And so that's when things started getting real. So I encourage all of you to not do what I did because it's so important to be confident in yourself and but not to the point where you don't apply to anywhere else. So I started applying to places in like February, March, and I started applying everywhere. Um, I I applied to not as many hospitals as Tara and Michelle did, but I applied to about 25 hospitals total. And I tried expanding, but I did not want to leave California. I I love California. It's so safe here. The ratios are so good. The laws, the nursing laws are so good. I love it here, and I did not want to leave. So I only applied to California. I had a bit of interviews, but it never led to an offer until honestly I applied to Kaiser. Okay, here, let me share my screen. Hold on. I have I have my little spreadsheet here. I hope you guys can see my screen. Okay, so I made a spreadsheet. This was my spreadsheet. This is when I started getting really serious. Um, and I color coded it and everything, and I had like the application dates, the units, the pay, everything. I had it all. And this really helped. This really helped. So see, I only applied to like 26 hospitals, which is still a lot. Um, but this is what helped me. So basically, I applied to Kaiser. I didn't apply the first round, which is the round when I was in fifth semester, but I applied on March 30th and I got an interview for May 7th. And my interview, so the way Kaiser works is a little different. Here's the website and it has the application dates. I think this one is for you guys, cohort two. Um, so Kaiser, I got the interview, and the interviews, you choose what part of NorCal you want to interview with or you want to go to, and it's like a general region. So they have like a region for Sacramento, and it includes like Sacramento, Roseville, and there's like two Kaisers in Sacramento. And then there's the San Francisco region, which is San Francisco, South San Francisco, Redwood City, and that stuff. And they have so many different regions. So you choose your top two regions. Mine was San Francisco region and San Jose region, which is only San Jose and Santa Clara. Um, and I chose the San Francisco region. So when I was offered an interview, um, they I got offered an interview for the San Francisco region. So then you choose what exact hospital you want to interview with, and you can only choose one hospital. So it's either San Francisco, South San Francisco, San Rafael, or Redwood City. And you choose one, and that's the only hospital you'll get interviewed with. So I chose South San Francisco. Oh, Leo, you have a question. Go ahead.
Sorry to interrupt you. Um,
It's okay.
I so I see that the Kaiser there's like different regions. Um, can
Yes, I
when
showed
you
it.
apply, can you be able to like apply to different region all at once? Kind of like you said there's San Francisco, there's SAC, all that stuff. Can you like apply different region? Like let's just say you get interview, can you like, just still like participate, or is it only like limited to like one region at the end?
Yeah, that's a good question. So I should have clarified. The Kaiser NorCal application is just one application. Like you just submit that application and you don't choose any regions at all until they send you a supplemental questionnaire. And that's where they'll ask you. They send it to everyone though. They'll ask you what your preferred region is, and you can only choose two. You can only choose two. So after that, like you can't switch or say you want to go to any other region. So yeah, you can't like apply to multiple different regions. It's just one application and then you choose your top two regions and then they'll choose for you which one region you can interview for. I hope that answers your question.
Yeah, that's really helpful. Thank you. So like
Yeah.
for Kaiser, there's like NorCal and is there's also other like places
Yes.
like that I can apply. Like for NorCal, just you have to just keep getting limited and limited. Can you also do that? Can you also do like from two other places, like let's just say SoCal or like some other stuff like that?
Yes, so SoCal, so yeah, NorCal is its own, SoCal is its own separate application. So that's like a completely different separate application. Um, I did apply to Kaiser SoCal, so you can apply to both. They're different, like they come out at different times. And the website, this website, you like choose, look, like I chose Northern California. And you can also choose Southern California, and it'll be like separate dates.
Okay, gotcha. Thank you so much.
Yeah. And they also have other states, but these are the two California ones. Um, and I did, oh shoot, I'm losing track here. I did apply to the SoCal one and I got an interview. I went all the way to Irvine and they have more specialized units out there. It was for the direct observation unit. I think. And they had like specific stuff like L&D. It was not all med surg tele. So that's the cool part about over there, but the pay is a lot less. That's one thing about LA. I was very surprised how low the pay is for such an expensive area. You could see the big difference here, like the 52. Oh, that's Reading. But where is it? Like San Diego, 56. Yeah, but yeah, okay. So as I was saying about Kaiser here, um, so yeah, I interviewed with South San Francisco, and the reason I chose South San Francisco was because my sister lives here in San Bruno, which is 10 minutes away from South San Francisco. And I have always wanted to work in the Bay Area. Obviously, Stanford was the goal, and it was mainly because the Bay Area. That's been my goal. And it was starting to look like that wasn't going to happen because of how competitive it is everywhere in California. Like everywhere, even Reading, Enloe, Marysville, they all rejected me. I'm like, I did all my clinicals with you guys and you guys rejected me. That was that was crazy. This application process like really humbled me. But yeah, so I chose South San Francisco because of that. And it's a smaller hospital. Like Kaiser San Francisco is a very big hospital. Kaiser South San Francisco is smaller. Um, there's only med surge and then med surge tele floors and an ICU, and that's all. And I was okay with that though, because it looked like a nice place. And I hate San Francisco. I'm sorry. I hate San Francisco and I did not want to work there. And I did not want to pay $400 a month for parking. And yeah, so that's why I didn't choose it. And ultimately it worked out. Kaiser does group interviews, which sucked. There was six of us in an interview. It lasted 2 hours. 2 hours. That was the longest interview ever because Stanford had like 4 or 5 of us and lasted like an hour or so. But six people, 2 hours, and it was on Zoom. So I was sitting in my room in Chico, my hot ass room in Chico, burning alive, listening to other people have these amazing answers. It it just felt so competitive, but what I did, and I think it really helped me, I started treating these interviews like a game. Like I was like, I know I'm worthy of this spot, and I'm going to show them that I'm confident and that I am meant for this job. So I put my all into that interview. Like I I think that made me realize that personality is everything in interviews because they really look for who you are, like deep down, besides all the nursing skills and all the jobs you've had. I really do think that made a big difference. And I tried to really connect with the managers, but it's so hard to when there's 5 other people also trying to connect. But I had to like really force myself in there. Like when they asked if we had questions, I had to shove myself in there and ask like a second question to try to make myself more seen. And I do think that helped. And then I got the offer. My interview was May 7th, and I got the offer on May 19th. And that was the craziest day of my life. I was very grateful. And after all these rejections and everything, I really do feel like everything happens for a reason. And I just want all of you to know that because this nursing application process is insane and it should not be this hard to find a job at all. Especially with how short-staffed a lot of hospitals are, Kaiser included. Um, it is not fair. So just really when you're applying and a rejection happens, just know that like it happened for a reason. Like you were not meant to be there, and that's okay. Like, because something better is out there for you. And now looking at it, like I can't imagine being anywhere else. Like, I'm so happy I didn't go to Stanford. I love my job. I love Kaiser. The benefits are amazing. The hospital is amazing. And I love where I live. I live with my sister. Well, I don't live with her, but we live in the same apartment complex. Like, I would have imagined. And I'm literally living in my dream area where I'm far enough from San Francisco that I can just visit and get away. And I live in South San Fran. Well, I live in San Bruno, but basically South San Francisco, and there's like no traffic here, and everything's like much more mellow, and I love it. Love it. So it worked out so well, and that's gonna happen with you guys. Like, don't give up. Don't let these hospitals ruin your mind. Like they will try to tear you down and it's not worth it. Like they were not meant for you. Okay, Leo.
Hi, thank you so much for sharing your experience. It's so inspiring. I love that for you. And then
Thank you.
yeah, and like it's just really hard and like for these hospitals, how do you like really, prepare yourself like, cuz like I was also asking the same question to Michelle, like how do you find these like residency program, and also like when you find these residency program, like after you get rejected, like is there's a chance that you would just actually apply to that place second time if it's waiting?
Yeah. So, luckily with these residency programs, you can apply as many times as you want and they can't like tell you no. It's just a lot of them have certain requirements, like you had to have graduated in the past 6 months or 12 months or no experience, this and that. Like they have very specific things, each of them. But I found these residency programs, honestly, I just looked up nurse residency programs in California and they'll come up. I found all of these through the actual hospital website. Like I didn't go through LinkedIn or Indeed or any of that because I knew that those were mostly not real. So I just would look it up, and all these hospitals would come up with like their own link, said nurse residency program. And then I also was on that new grad RN Bay Area Facebook group. That group is popping. That group, like people are on there all the time and they are constantly talking about like what hospital opened up. And it's not just the Bay Area, even though they're called the Bay Area, it's like for all of California. So that's where I found a lot of information as well. So join that Facebook group because people are on there all day, every day asking questions, and you're anonymous. So no one knows who you are, and people are just posting all this information. So yeah, that's how I found these programs.
That's good. Thank you. And like a curious question, does Kaiser, let's just say Kaiser, or like does Kaiser have CNA?
Yeah, so Kaiser calls them PCTs for some reason, patient care technicians. Um, I'm not gonna lie to you, Kaiser, for being such a big hospital, they should be better staffed, but we do have PCTs. I'm on the day shift. Sorry, I should actually talk about what I'm doing. I'm on the day shift. I've been training on the day shift. This is week 10. Next week is week 11, and then I go independent. Um, so we do have PCTs, but it's only one. It's only one. But luckily, it's 22. We have 22 beds on my unit. So it's not that much, but at the same time, if you really think about it, one PCT for 22 people is crazy. But, and sometimes we do have two, at least for a few hours, like for the main hours, like 7 to 11, we do have two. And they're very helpful. Like, even though it's just one or two of them, they are helpful. They try their best, and sometimes it's hard, but luckily the nurses are amazing and they're always willing to help. So that helps a lot too.
That's good. Thank you. So like one more question. I'm so sorry.
It's okay. You're
So
good.
like for Kaiser or just in things in general, like residency program, do they describe how the floor looks like? Do you know what you're gonna do you know what to expect before you even take the residency offer? Let's just say the patient ratio, the helpers, the staffing and all that stuff. Like, do they tell you that, or do you just find out that when you get on the floor?
Yes, sadly, you find all that out once you get there. And
Oh,
also, if you find people, well, like in the interview, obviously, in the interview or when you get the offer, you can ask them, like, what are your ratios? What does your staffing look like? Especially once you get the offer, you can definitely ask them that before accepting, and you should ask that. Um, I I just kind of figure it out when I got there, but a lot of people like also post on that Facebook group. They post like, this is my experience at Kaiser, this is how it is. So you can also find people that have been through it and find out through them. And there's so many people online that will like answer your questions. But yeah, you find out as you go too.
got it. That's good to know. Thank you so much. You're so helpful.
Yeah, yeah, of course. So yeah, let me tell you about my experience now. I started July 28th. You get 2 weeks of basic orientation, typical stuff. And then you start on the floor with your preceptor. I have three preceptors. Um, and I'm kind of balanced with them. 1 week I'm with one, and it's just whoever's available, but it's only them three. And the preceptors, luckily, since they sign up to be preceptors, they're very kind, very nice, and they genuinely do want to help you. And so yeah, 11 weeks of precepting, and then you go independent. So I just got my independent position. I'm going to be on day shift. Who would have thought? I wouldn't have thought. I thought I was going to be on nights, and I low-key wanted nights because that differential is fat. So I low-key wanted nights, but here I am. Who would have thought? I'm on day shift. Kaiser, not all of them. My hospital is 8-hour shifts. And that also I would not have thought. I would not have thought I'd ever be in 8-hour shifts because 12 hours, that's what everyone gets. And it's only 8-hour shifts at the one I'm at. And I found out most Kaisers are like that. There's only a few Kaisers that are 12 hours. I think one of them is Vallejo. I don't know. But I'm 8 hours, so I've been working 40 hours a week. But it's only because we have a new grad class every single Tuesday. One week it's in person and one week it's virtual. So you go on a Zoom and then you do modules. And honestly, I love working from home because I'm like, I'm getting paid to just be on this Zoom. And yeah, so that's how that's been going. And then at week 12, I go alone, and then that's 3 months. And then at month 6, I become a staff nurse too. Um, and yeah, I have a 1-year commitment to the residency program. So I graduate in July, but there's the probation period is just the preceptorship. And then once I go on my own, I'm no longer on probation. Yeah, that's me. Telemetry is is crazy. I would have never thought that I would have to know this much about like EKGs and the heart and all this stuff, but I'm learning as I go and I really am enjoying it, even though it is chaotic at times. I am enjoying it and I do like Kaiser a lot because I love their benefits and their money. And the people are really nice, really, really nice. And honestly, everyone says that once you get into a Kaiser, don't leave because it's so hard to find a job there. And then they take good care of us. So I'm grateful. And that's enough about me. If you guys have questions, I'll answer. Sorry, I yap a lot.
I think Haley had a question in the chat. If
Oh,
you,
shoot.
oh, you're good.
Okay. What kind of things were on your resume that you think help you stand out? Okay, let me share my resume actually. I have it right here. My resume was 3 pages. I know that's a lot, but I tried to do so many things in school. Mainly because I like it. I liked like talking to pre-nursing students and nursing students and being involved. Like I thought it was fun. So that's why I did it. But this is my experience. I did work while I was in school. It was very hard, but I worked and yes, I was an LVN. And that obviously has helped a lot. I feel like it helped with the interview questions and everything. Um, but yeah, these were some of the things I included in the leadership experience. I was in United in Nursing, but I was the vice president for the Chico State Nursing Club, and I was also a senior officer. Um, this is some stuff. And then I included volunteer experience, and then my licenses and certifications. And then I also included our clinical hours. But Yeah, I really tried to perfect my resume, and I just want to say, like, just because my resume is huge and all this stuff, like if yours isn't, that's okay. Like you don't need to have all this experience, because at the end of the day, look, I had all this experience and yeah, it helped, and look at all this. So like it doesn't matter if you have so much experience. What really matters is how you present yourself in these interviews. So just like put your all in these interviews. And as long as you're you, like people will love you. Like they will love you. Like someone will see how amazing you are. And even if it takes 6 months, they're like, I hope it doesn't, but if it does, like you're gonna end up exactly where you're meant to be. Okay. What else? But yeah, it's to stand out. I really think that leadership experience helped a lot. And it was things that I could talk about in the interview, so that was really helpful. How many days a week do you work? Okay. So when I start independently, I'll be working 4 days a week because I'll be 32 hours. I'm not gonna be 40 hours. 32 hours a week. So 4 days a week. So yeah, I work 7 a.m. to 3:30 p.m., which I kind of like it. Like 8 hours goes by so fast. Like it goes by insanely fast. Like I don't even know where my day goes. But it's kind of nice. I didn't think I would like 8 hours, but it is kind of nice. Um, yeah, that's how many days I work. Right now it's 5 though. But it's almost over. Yeah. Any other questions? Also, another thing, your cover letter, you put your all into that cover letter. Like, really put your all. I can also share my cover letter. And it's okay to use like ChatGPT to help you like write it. Like you just don't obviously put the whole thing it's ChatGPT, but like it can help you like make it look cleaner. Like I would write mine and then have ChatGPT make it look cleaner, and it helped so much because mine would sometimes look like a mess, and it helped. Just really like show who you are in this cover letter because they're going to be reading this, and that's basically you in one letter. Um, yeah, I can share all this stuff. I don't mind all this, but yeah, any other questions?
Does anyone have any other questions? This is your chance to ask about anything. Oh, Leo.
Leo.
Oh my gosh, I have something to ask.
It's
Um,
okay.
so like, for you or just in general, like, how does people or even you, like, how does like nursing student or like new grad find out like what they like to do? I know sometimes like there's not much choice because of the residency program is like, strict to like, oh, whoever they hire. But like,
Mhm.
how do people like usually find out or get to experience or get to shadow like, what kind of unit that they like to be in? Because it's kind of challenging for me. I just been shifting so many units. Sometimes I'm like I haven't even started those, but like I just always like, oh, I want to work in that unit. I want to work in this unit. And sometimes you're like, I don't like that unit anymore and stuff. I don't know how people figure out what they want to do as a nurse.
I know it's so hard to figure it out, and honestly, you don't have to figure it out when you're in school. Like obviously that's the time that you're gonna get all the different like unit experiences. But it's okay to not have it figured out. Like you can like something one day and then hate it the next day, and that's okay. Like once it comes to working, like you're gonna find out what you like and don't like. Even if you're just in that one unit, like you're gonna find out. And I thought I thought so many different things in school. I was like, I'm gonna do this, 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 this. And obviously, te med-surg tele wasn't my first option. Um, but now that I'm here, I actually am grateful to be here and I do enjoy the chaos. Um, it is very chaotic, but I kind of love it. And I never would have thought that I would like it, and I do. So you just gotta figure out as you go. And unfortunately, like there's never gonna be one set unit. Like even now, I'm like, I don't know where I want to go after this year. Like I want to do ER, but am I really gonna want to do ER in a year? Like, so you will figure it out as you go. And you
Okay,
have all the options in the world. That's what's so beautiful about nursing. You can do whatever you want.
that's good. Thank you so much. That is so
Mm,
helpful. I
yes,
have one more question. Sorry.
it's okay.
Um, so like when you apply for residency program, I get that we have to take NCLEX and everything. Would you recommend us to apply for residency program? I know the timelines are different, obviously. And
Mhm.
would you recommend us to start applying for residency program, like start looking, start applying, like before you graduate or after you graduate and take the NCLEX and you apply?
I would say before you graduate, because that's when a lot of them start opening, especially at the like midway point of your fifth semester. That's when a lot of them start opening. So like start looking at the beginning of fifth semester or in your winter break or summer break, however your fifth semester is. Just start looking. Um, but yeah, definitely apply to the ones that become available like during your fifth semester. Because the earlier you apply, the better, and the more places you apply to, the better. Like apply to as many places as you can, even if you don't want to work there. Like just get get the interview. And if you end up somewhere that like you never would have imagined that you would have been, like just get the experience and then you will end up where you want to be. Like, yeah, that's my advice there.
Thank you so much. That is so helpful because like I was just like I'm on the same page with you that I don't want to leave California, but like after hearing all
Mhm.
this, I'm gonna start applying to other states just in case because I
Mhm.
just want to get the experience and then start working like officially at somewhere I want to be. Thank you so much. It is really
Mhm.
helpful for you guys today.
Yeah, and that's okay to start somewhere else. Like even if it's not in California. A lot of my classmates ended up doing that. A lot of them moved out, and I know eventually they want to come back. So yeah, get your experience. And who knows, you could love that state. Like, just don't go to Texas. But like states like, Washington, I think that's the only state I know that has good ratios. But there's good states, not all of them are bad.
Got it.
Yeah.
Thank you so much.
Yes. Any other questions?
Anyone have any other questions?
I can put my phone number in the chat.
Yeah, I was about to ask you. I was like, I don't think I asked, or I got if you had like a contact information that you wanted me to share with everyone. Do you wanted to like send an email or something too?
Yeah, I put my email and my phone number. You can text me, message me, whatever, anytime. Like, I am here for you. Uh, Yeah.
Well, thank you so much, Rebecca, for um just setting aside time to speak with us. Like hearing your experience was super helpful, and I'm sure everybody in the club can agree. With that, I'm going to. I want to see, is everyone comfortable with taking like a picture, like a screenshot picture? Okay, if everyone could like turn on their cameras for a very quick like screenshot, that'd be awesome. Just for our like little recap picture or recap post, that'd be awesome. Okay. Whenever you're ready, Sam. Just give us a thumbs up once you're done. Good? Yeah? Okay, cool. All right. Thank you again, Rebecca. Again, everybody, don't forget we have a fundraiser on the 15th. And then if you're interested in applying for the volunteer event or for officers, I really do encourage you, especially hearing all of this now. Hopefully that's a big push. But yeah, I hope you guys have a great, fun, and restful, safe day. We'll see you all again in November. Bye. Thank you again, Rebecca.
Thank you.
Thank
Thanks for
you.
organizing.
Thank
No
you.
worries.
Thank you. Thank you.
Bye bye.
You did amazing.
You did awesome, girl. I'm so happy. I was like very surprised. I was like, there's no way she's gonna say yes because it's so. I felt it was like so last minute. I was like, do
No,
you wait?
you can invite me to anything.
6 hours? That's crazy.
Mhm.
That's so.
8 hours is crazy.